Hello students, welcome to Legacy IAS Academy. In today's video, we are going to discuss about a medical term that is in news, that is called as thrombosis with thrombocytopenia syndrome, or in short it is also referred as TTS syndrome. Now this syndrome is news related to the Covishield vaccine that was prepared by the AstraZeneca to fight against the Covid-19 infection. So can Covishield cause this rare side effect? Let us try to understand this in this particular video. So to give you a brief context or background of this particular news, basically AstraZeneca, which is a Swedish-British company, a pharmaceutical company, it for the first time has admitted in the court of United Kingdom that COVID vaccine that it has prepared can cause the rare side effects, and one of those rare side effect is disease that is referred as thrombosis with thrombocytopenia syndrome. The pharmaceutical company is also being sued in class action over claims that its vaccine against COVID-19 that was developed with University of Oxford has resulted into fatality, has resulted into death because of this particular syndrome. Now in this context, lawyers have also argued that the vaccine prepared in joint form by AstraZeneca and University of Oxford is defective and that its efficacy has been vastly overstated. Now this particular claim of the lawyers have been largely or categorically rejected by AstraZeneca, which has said that WHO has verified the efficacy of vaccine and as such there is no problem in efficacy. However, in very rare situation, rare circumstances, TTS syndrome is something that one can actually be affected with after taking this particular vaccine. So let us try to understand about this vaccine also in slight detail. So we know that AstraZeneca in collaboration with University of Oxford had developed a vaccine that is called as AZD1222 after the outbreak of coronavirus in year 2020. If we talk about India and many other low and middle income countries, this vaccine was manufactured and supplied under the brand name of Covishield, and this Covishield vaccine, as far as India is concerned, it was prepared or manufactured by Serum Institute of India after it has taken the license by the university as well as the Swedish-British drug maker, that is AstraZeneca. So let us try to understand about Covishield vaccine and how it is different from the other vaccines, for example Pfizer's vaccine. So Covishield is not based on mRNA platform on which the Pfizer's vaccine was basically based on, rather it is based on a viral vector platform. Now basically in the Covishield vaccine, a modified chimpanzee virus that is called as adenovirus by the name of CHAdOX1 actually been used to deliver the COVID-19 spike protein into the human cells. Now basically the human body will not get any kind of infection. Basically the cold virus that we are using here, or the which AstraZeneca has used in the adenovirus, actually it cannot infect the recipient, the humans, but it can effectively instruct the immune system to prepare defenses against similar virus if the human body is infected, and that is basically how the antiviral basically works upon. Now in this context, World Health Organization also in year 2023 has said that TTS emerged as a new adverse event following immunization in individuals who are vaccinated, and this is seen in such kind of vaccine which has been using adenovirus, and this includes AstraZeneca's COVID-19 vaccine as well as vaccine prepared by Johnson & Johnson. The vaccine was very popularly known by its brand name of Janssen, COVID-19 8026.CoV2S vaccine. So these two vaccines were more likely to create such kind of problems in the individuals after immunization. This is something that WHO has also accepted. Now let us try to understand briefly about the TTS syndrome also. So TTS basically is also known by other name of VIPIT, that means vaccine induced prothrombic immune thrombocytopenia, or vaccine induced immune thrombotic thrombocytopenia, VITT or VIPT or TSS. All these are basically referring to the same kind of disease. Now it is a very rare kind of syndrome that was reported in people who have received these two vaccines. One Vaxzevria that is prepared by AstraZeneca, another Janssen, that is Johnson & Johnson's COVID-19 vaccine. Now, as you can see clearly from this term, two terms are used here. One term is thrombosis and other term that we are using here is thrombocytopenia. So, thrombosis formation basically refers to the formation or development of clots, blood clots. Blood clots generally develop if suppose you get a cut, then to prevent the blood from continuously leaking out your body, the clots is generated. Now, this clot is beneficial, but sometime if in the veins itself blood clots get generated, then basically it obstructs the flow of the blood, and as the blood flow is obstructed in the critical veins, it can cause fatality to the humans as well. That is thrombosis. And on the other hand, you also have a thrombocytopenia, which means low platelet count. We know that human blood is made up of different we have elements are there, for example, red blood cells, we have white blood cells, we have plasma, then we have the platelets. So, in the thrombocytopenia that is caused after intake of this vaccine, or that may be caused due to intake of this vaccine, is referring to a situation where the platelet counts of the blood cells in human body that actually is very beneficial or helpful in formation of blood clot that can help in stopping of bleeding. That count basically decreases. For example, if you look at the normal platelet count of human blood, platelets should be in the range of 150,000 to 450,000. However, if the body is suffering from thrombocytopenia, in this case the platelet count becomes lesser than 140,000. That means much more lesser than the normal platelet count. And in this case, if you have thrombocytopenia, you may bleed a lot and the bleeding may be hard to stop, and often it affects people with certain medical conditions. If you are not talking about the vaccine induced thrombocytopenia, in that case the people who are having autoimmune diseases, for example Huntington diseases, or who take certain kind of medications, especially if some cancer patients are there, then in those people we are seeing this kind of diseases. Now, the exact mechanism that how this particular disease, that is TTS syndrome, is triggered is still under investigation. However, the majority of cases that have been reported across the world were associated with the finding of a special kind of antibodies that develop in human bodies. These antibodies are referred as anti-PF4 antibodies. So, these antibodies are believed to be directly related to the thrombocytopenia in human body. Now, if suppose a person suffer from this particular kind of thrombocytopenia, now again we have discussed the normal platelet count should be 150 to 450,000 platelets per microliter of blood. That is where generally all the blood values are all the components of blood we are basically measuring in. Now, if thrombocytopenia levels are demarcated into three types: mild thrombocytopenia, then we have moderate thrombocytopenia and severe thrombocytopenia, and associated numbers are written here. For example, if platelet levels are between 101,000 to 140,000, then it is mild. If it is between 51,000 to 100,000, then it becomes moderate, and if the platelet count reduces further below to somewhere between 51,000 to 21,000, then this comes under the case of severe thrombocytopenia. Now, what are the symptoms that a human observes when this kind of disease strikes body? So, first symptom is what is called as petechia. Petechia refers to appearance of tiny red or purple kind of rashes, we can say dots on the lower legs that resemble like a rash. So, petechia is there. Second symptom is called as purpura. Now, purpura refer to a red, purple or brown spots that develops on the skin, and this happens when a small blood vessel, because you know that below our skin we have so many blood vessels that are circulating blood inside the body. So, suppose that if blood clot has happened, obviously what will happen? The blood flow will be obstructed in that particular veins or that particular blood vessel, and that will start leaking blood. So, in this case such kind of symptom is called as purpura. And last is appearance of bruises on the body. Bruises happens when the blood pools under the skin, and you may notice you are developing bruises more easily than usual. So, these are three major symptoms: petechia, purpura and bruises that are associated with the given disease. Now, what are the treatments? So, 3-4 major treatment regimes are there. If a person has developed thrombocytopenia, the first treatment regime depends on the use of steroids. Steroids are something that are kind of a medication, and it helps in boosting the platelet protections of the human body. And as we have discussed, this disease, that is thrombocytopenia, it basically reduces the platelet level. So to counter that, steroids are given that elevates the platelet count in the body. Second is blood transfusion. If platelet count has become very low, that it cannot be boosted anymore, in that case the entire blood has to be transfused, entire blood has to be changed. So platelet level is very low, then healthcare provider can ask for the blood transfusion. Again, this is not a permanent cure, because we know that blood transfusion can work mainly for 2 to 3 days, and again the procedure has to be repeated in the hospital. Third treatment is called as splenectomy. Now we know that in a human body we have the spleen. So the surgery of removal of spleen is called as splenectomy. So surgeon may do this if test so that the spleen of the body is trapping large number of platelets, and that is the reason behind the low number or low volume of platelets in human blood. So people who have splenectomies have an increased risk of developing infections. On the negative side, they may receive vaccinations to prevent further infections also. So the use of steroid, blood transfusion for short-term purposes, process, and splenectomy, these three are the major, or you can say, treatment that are available to us for the treatment of thrombocytopenia. Now in this entire development that has happened, what has been the response of the vaccine maker AstraZeneca? So obviously they have said, they have released a statement, and they have shown sympathy to anyone who has lost life or reported to have health problem due to intake of these vaccines. But on the other hand, they also have said that the safety of patient is something that is very high on their agenda, and regulatory authorities have cleared their vaccine, plus they have a stringent standard to ensure the safe use of all medicines including the vaccine. And that is why, according to WHO, they also have tried to say that the WHO has given vaccine a safe status, and it also is said it is effective for all individuals who are aged between 18 and above. And the adverse effect, whatever has been observed, has prompted the legal action is very rare. So again, actually if you look at the data, it shows the data that has been released by the Australian National Health Authorities. It shows that there is chance of, if 100,000 vaccines are given, there is chance that 2.5 people will be the one who might have this rare symptoms, adverse symptoms of TTS syndrome. So that is all about this particular news. I hope you understood that why this entire, or what about this entire hullabaloo is all about the Covishield and its efficacy, as well as the related thrombosis. Thank you very much.